Dry mouth, xerostomia. Xerostomia, also known as dry mouth, is dryness in the mouth, which may be associated with a change in the composition of saliva, or reduced salivary flow, or have no identifiable cause. Dry mouth is often due to the side effect of certain medications or aging issues, or as a result of radiation therapy for cancer. Less often, dry mouth may be caused by a condition that directly affects the salivary glands. This symptom is very common. It is very common in older people, mostly because this group tend to take several medications, and in persons who breathe through their mouths. Dehydration, radiotherapy involving the salivary glands, chemotherapy in several diseases, can cause reduced salivation, hyposalivation, or a change in saliva consistency, and hence the complaint of xerostomia. There may also be a psychogenic reason for the complaint, but sometimes there is no identifiable cause. Saliva aids in the prevention of tooth decay by neutralizing bacterial acids, limiting bacterial growth, and washing away food particles. Saliva also improves your taste and makes it easier to chew and swallow. Furthermore, salivary enzymes aid in digestion. Reduced saliva and dry mouth can range from being a minor annoyance to having a significant impact on your overall health, the health of your teeth and gums, as well as your appetite and enjoyment of food. Symptoms. If you're not producing enough saliva, you may notice these signs and symptoms all or most of the time. Acid erosion of teeth. Dryness or a feeling of stickiness in your mouth. A burning or tingling sensation in the mouth. Saliva that seems thick and stringy. Lipstick or food may stick to the teeth. Bad breath. Oral candidiasis. Difficulty chewing, speaking and swallowing. Dry or sore throat and hoarseness. Altered taste sensation. Dry or grooved tongue. Difficulty wearing dentures. The tongue may stick to the palate. Mouth soreness and oral mucositis. A changed sense of taste. What are the causes? Dry mouth is caused when the salivary glands in the mouth don't make enough saliva to keep your mouth wet. These glands may not work properly as the result of the following. Aging. Many older people experience dry mouth as they age. Contributing factors include the use of certain medications, changes in the body's ability to process medication, inadequate nutrition, and having long-term health problems. Physiologic. Salivary flow rate is decreased during sleep, which may lead to a transient sensation of dry mouth upon waking. This disappears with eating or drinking or with oral hygiene. When associated with halitosis, this is sometimes termed morning breath. Dry mouth is also a common sensation during periods of anxiety, probably owing to enhanced sympathetic drive.
The main part of anxiety is physical. Dizzy spells, dry mouth, distorted hearing.
Chemotherapy drugs can change the nature of saliva and the amount produced. This may be temporary, with normal salivary flow returning after treatment is completed. Radiation treatments to your head and neck can damage salivary glands, causing a marked decrease in saliva production. This may be temporary or permanent, depending on the radiation dose and area treated. Nerve damage. An injury or surgery that causes nerve damage to your head and neck area can result in dry mouth. Other health conditions. Dry mouth can be due to certain health conditions, such as diabetes, stroke, yeast infection, thrush in your mouth or Alzheimer's disease, or due to autoimmune diseases, such as Sjogren's syndrome. Snoring and breathing with your mouth open also can contribute to dry mouth. Tobacco. Smoking or chewing tobacco can increase dry mouth symptoms. Alcohol can be involved in the cause of salivary gland disease, liver disease, or dehydration. Recreational drug use. Methamphetamine use can cause severe dry mouth and damage to teeth, a condition also known as meth mouth. Marijuana also can cause dry mouth. COVID-19. Xerostomia is one of the most prevalent and persistent oral symptoms associated with COVID-19. Despite a close association with COVID-19, xerostomia, dry mouth and hypersalivation tend to be overlooked in COVID-19 patients and survivors. Dry mouth treatment. The successful treatment of xerostomia is difficult to achieve and often unsatisfactory. For the best long-term dry mouth remedy, you need to address its cause, but you can do some things to relieve dry mouth temporarily. To help relieve the symptoms of dry mouth, try the following. Saliva Substitutes. These are viscous products which are applied to the oral mucosa, which can be found in the form of sprays, gels, oils, mouthwashes, mouth rinses, pastilles or viscous liquids. This includes water, artificial salivas, mucin-based, carboxymethylcellulose-based, and other substances like milk and vegetable oil. Chew sugar-free gum or sugar-free candies to stimulate the flow of saliva. Caffeine can make your mouth drier, so limit your intake. Don't use mouthwashes that contain alcohol because they can be drying. Stop all tobacco use if you smoke or chew tobacco. Sip water regularly. Try over-the-counter saliva substitutes. Look for products containing xylitol or ones containing carboxymethylcellulose or hydroxyethyl cellulose. Try a mouthwash designed for dry mouth, especially one that contains xylitol. Avoid using over-the-counter antihistamines and decongestants because they can make your symptoms worse. Saliva stimulants. Medications which stimulate saliva production traditionally have been administered through oral tablets, which the patient goes on to swallow, although some saliva stimulants can also be found in the form of toothpastes. Also, lozenges, which are retained in the mouth and then swallowed. Breathe through your nose, not your mouth. Add moisture to the air at night with a room humidifier. Saliva is necessary for the health of your teeth and mouth. Take these precautions to protect your oral health if you frequently experience dry mouth. Avoid sugary or acidic foods and drinks because they increase your risk of tooth decay. Brush with a fluoride toothpaste. Visit your dentist at least twice yearly to detect and treat tooth decay or other dental problems. If the previous steps don't improve your dry mouth, talk to your doctor or dentist. The cause could be medication. Long-term relief from your dry mouth may mean stopping or changing your medication and/or its dosage, or addressing other underlying health issues. Do not stop taking any prescribed medications or treatments without consulting your doctor. The materials and the information contained on this channel are provided for general and educational purposes only, and do not constitute any legal, medical or other professional advice on any subject matter.